Congratulations! Okay, you've done a pregnancy test and it turned out positive. Congratulations! That can be an amazing information. But again, you're looking forward to have a healthy pregnancy journey. In this video today, I did a recap on the first trimester, the do's and the don'ts, what to expect during the first trimester, management of common symptoms like nausea, vomiting, heartburn, and again, we're going to share tips to have a healthy pregnancy journey in the first trimester. Watch to the end. Welcome to the Nursing Moms. If you like our videos, hit the like button and subscribe. Stay updated for more coming videos by hitting the notification bell. Pregnancy is divided into 3 trimesters, and the first trimester runs from the first day of your last menstrual period to the end of 12 weeks gestation. This is one of the most vulnerable trimesters throughout pregnancy, both to the mother and to the baby. To the baby, because it's that trimester that major body organs are being formed, and to the mother, because your body is trying to adjust to a foreign or a new, there's a life growing inside, and your body's immune first senses it like a foreign object, and your body is really trying to fight it. That is why you'll find this common, the morning sickness comes in. There are so many changes with your hormones in the first trimester. Again, one of the most questions that is being asked during this time is, when can I start going to the clinic? As soon as you realize you're pregnant, it's highly advisable to start the antenatal visits to the hospital. Book your doctor, book your nurse, identify an hospital, and start the clinic. It's through these visits that you'll have much benefits, like you'll get the ferrous and folic acid tablets, the vitamin supplements, and again, you have to know that the ferrofolic tablets are really important in the development of the baby, especially when taken in the first trimester when major organs of the babies are being developed. The folic tablets can prevent major birth defects like the neural tube defect, so you have to take it to help in a healthy baby and a healthy bones. Again, you have to take these visits very serious, because if you go to the hospital, you realize your doctor will ask for a blood test. Actually, he or she is looking for it. If at all you can have infections like syphilis, through the blood test, the doctor will know the blood level, the iron level, your rhesus, and again, check of infections like the urinary tract infections. You'll have to do your urinalysis. The general maternal health check is also very important in these clinic visits. You realize that your blood pressure, anything, if at all you have any concern, this is the best time to share it out with your doctor. Start these antenatal visits as soon as you realize you are pregnant. Don't wait for too long, because there is much benefit in starting earlier than starting late. Eating during pregnancy. Actually, this is one of the most challenging things in the first trimester to some women. Again, with some women, it's very smooth, there is less changes, but to some, you have food aversion. You're actually hating on the things that you used to previously love. You're having cravings even to the non-edible things. And again, some just don't want to eat, they're just there. Again, this is the time you're dealing with the nausea and vomiting. My dear, you really have to try. The best thing here is to try. Try as much as you can to eat, because there's a life inside you, and your body as well needs the nutrients. If at all you used to eat 3 meals a day, try as much as you can to get at least 5 meals a day. The secret behind this is not having a whole sitting, one big meal at a sitting. No, try to divide your meals into pieces, like you can just take just a bit of it. Again, after 1 hour or 2 hours, you can get another snack, just a bit of it, and you'll find it working, instead of having a whole sitting meal at once. Try to eat fresh vegetables and fruits. These are very important in your nutrients, and the vitamins, and again for the development of the baby. Again, you have to try as much as you can to stay hydrated. In this trimester, especially if you're vomiting, you have to curb the fluids that you are losing. Try as much as you can to at least get 8 glasses of water per day. For nausea and vomiting, actually this has been a challenge, but again, you can have an assurance that it's just a matter of time. So, endurance is very, very important in this. The tip here is to try avoid things that are making you nauseated. If at all it's fatty food, try as much as you can to avoid the fatty food, especially if you're vomiting. Try to boil your food without fat. To curb this, you can also use ginger. Ginger is very, very well known to help in nausea. Get ginger tea, you can get ginger capsules, you can add ginger in your foods. If at all it works well with you, then that is good. If not, just know that it is a matter of time and it will come to an end. This is happening due to changes in your hormones. Unless it's very, very extreme, that is where we have the hyperemesis gravitarum, then you will need an hospitalization to get the intravenous antiemetics and intravenous fluids to help you stay hydrated. If you experience constipation and bloating during your first trimester, which not every woman experiences, then just know that these are normal occurrences due to the changes in your hormones. Again, to curb this, you really have to try get a lot of roughages and a lot of fluids. Take enough drinking water and high fiber diet. This will help in constipation. And again, for the bloating, you have to try avoid food that have a lot of gas like beans and boiled eggs. Actually, it's a matter of time and all of this will just be okay. Reassurance in the first trimester is very, very important. Just know that you are dealing with something that a matter of time, it will be okay. In the first trimester, you realize you are always experiencing fatigue. Yeah, there's much fatigue, there is that dizziness, and you always find yourself sleeping. That is very, very normal. Try to find enough rest. Actually, rest during the day if you can, get a nap. And during the night, sleep for about 8 hours. It's healthy, and whatever is happening is just changes in your hormones, and there's a lot of activities going inside your womb, so that can lead to that fatigue. During the first trimester, you would also want to have an ultrasound done. Actually, it's important as this will help you know your expected date of delivery. The scan also will help you know the wellness of the baby. If at all there is any defect or any deformity, it will help you know it early enough and the well-being of the baby. Again, you'll have to realize that during the first trimester, there'll be major changes in your skin. Your inner thighs can be dark, and again, you'll be having acne. Actually, there is not much that can be done about it because some acne treatments during pregnancy are actually not safe. So these are things that with time they'll just have to disappear. It's occurring due to hormonal changes, and you just have to bear with it for that time. Things to avoid during the first trimester. No amount of alcohol is safe during pregnancy. Nor there is no time that alcohol can be safe, whichever the trimester throughout pregnancy. Again, you have to try as much as you can to avoid alcohol. Avoid smoking. If you're a smoker, then at least during pregnancy, you'll have to take a break because smoking and pregnancy doesn't really go well. Again, then another thing you have to avoid is the over-counter drugs, the self-prescribed drugs. The first trimester is a bit delicate, and again, there's some drugs that are not safe during pregnancy. Taking a drug that is not prescribed by your physician can be risky in pregnancy, and you have to try to avoid it as much as you can. If you have to take a drug that you think might help you, then consult your physician. Always have a contact of either your doctor or your nurse. You can consult before taking any drug that you have to buy yourself and was not prescribed.